afternoon and welcome to Have a Chat. I'm Audrey Lynch and with my co-stars Veronique Arsenault and Judy Loge. Good afternoon, ladies.
Hello, Audrey.
We're on the countdown. We've got a great show lined up for you today. We've got some amazing guests.
I know, full
and
show.
We have lots to talk about in our quick chat, but we're going to start off with my quote of the day, which Judy was kind enough to hunt down for me today because I'm actually working a full day today and scooted out just to do the show because I didn't want to miss our last show before Christmas Eve.
A little act of kindness.
Yes, exactly.
And my voice is sketchy, but it's just
Yes.
from being
all good.
overtired. I'm good.
You got the sexy
hanging
thing
in there.
Sexy thing
That-
going on.
oh yes, that's
Oh,
right
yeah.
too. Yeah,
So, it's not a hangover.
guys can do it. Then why can't we
I
have
don't
that
like it, but I have
raspy?
there's people have to listen to me today, so just
You're
for
all
an
right.
hour.
You're all right.
So we'll start off with our positive quote of the day, and I have to say it did make me smile. Okay, so it did smile, laugh, giggle, all of that. It says to never worry about the size of your Christmas tree. In the eyes of children, they're all 30 feet tall. And that's from Larry Wilde. So that's a quote from him. And that is so true. This time of year, when we're running around trying to get the perfect gift or get enough gifts, and it is so true. Whereas my children are so far apart in age, where I have, almost a 20 and a 22, and then I have my little ones. To her, it's through her that I still see that those things don't matter.
True.
And the tree does.
Yeah.
Yes.
Yeah. She
Yeah,
couldn't get it up quick enough or fast enough or,
Aw.
you know what I mean? Like some people want to wait until it's a little later. My husband wants to be a lot closer to Christmas. And of course, in my dad's day, he goes, that was one of the Christmas presents. You woke up and the tree was
Oh
up.
my!
I was like, and I'm
Oh,
like,
no, that'd be too
well,
late.
no,
That'd be
no, that would be way too much work for me on Christmas Eve. But it's still through her that I see
Yeah.
that, the excitement of Christmas and that there's still lots to look forward
And the
to.
glitter and the lights and the
Yeah.
ornaments and
Go
everything.
for
The
it.
whole thing. Christmas is what would Christmas be without a tree?
Yeah,
No,
that's true.
exactly. That's
Yep.
just it.
Charlie
So
Brown liked
the
it.
size of your tree doesn't matter.
Right.
That's right. You're right. Size,
Size
does not matter.
does matter.
Size does not matter. Judy.
okay.
So up next, we're going to be chit-chatting on our quick chat portion of the show. Steve Harvey was hosting the Miss Universe
sad.
pageant.
Yeah.
And wow.
I wanted to die for him.
I so like him.
I
love
like him
too, but
I watch Family Feud because of him.
I was saddened by
My
him.
husband watches hours and hours and hours, and he's usually so good with off-the-cuff
I know.
kind of thing.
So
And
we should probably major.
we should probably
It
tell
was
viewers though
major.
what he did.
So
Yes,
the Miss
in
Universe
case you missed
pageant.
it.
Yes.
Definitely. When it came to announcing, we were down to Miss Philippines and Miss Colombia.
Beautiful.
And usually what happens is when they go to announce, now they're about to announce, we're down to 2 people, and you announce who the runner-up is, and automatically everybody will know that the other
Exactly.
person
Exactly.
is. But when he announced it, he said that she was
Yeah.
Miss
The winner.
Universe.
Yeah.
Miss Colombia.
Yes.
And they crowned her. They gave her the sash.
think it was
They
like
gave
4
her the
minutes.
flowers.
She was drop
She
dead gorgeous. I mean, they
And-
all were, but she was
Yeah.
spectacular.
He had to come back out. He had to come back on stage, and everybody was looking around, and they're smiling, and he's, I'm
imagine?
so
No.
sorry, I have to apologize. And she looked at him,
So sad.
and then she smiled again, and then the camera was showing Miss
Philippines in shock.
And she's like, what?
Yes,
What?
yes, what?
And I was just like, the hair on the back of my neck was
I felt
standing up.
so bad
I
for
did.
Miss
So,
Columbia.
so
Yeah.
Miss Philippines won in the end.
No.
Really.
And
But-
I don't know who the other announcer was that I could hear in the background because there was other commentators throughout the show.
Wasn't Donald
and
Trump.
the woman, no, it was a woman, and very clearly you can hear her saying, "Are you kidding me?
Yeah.
Are you
Well, really,
joking?"
though, and
it's true.
a forum
'Cause
like that.
He's a comedian anyway, so
Yeah.
you're like, that's not a really
It's not a
good
good
time to joke.
But viewed all around the world, and what a catastrophe.
Yeah.
To me.
And hard, right? Because both women, of course, like it's hard work. People I've often
Being
seen,
beautiful.
yeah,
Yeah.
that part.
Well,
But
they
I've
put
often
a
seen-
lot of work.
Yeah, I've often seen on Facebook, oh, it's just a beauty pageant. But
No.
I mean, it's hard work. Like they work at their appearance for sure, but they're also expected
Lawyers.
to. They're all in school. They're professional women.
Yes,
They're
have a platform to talk about.
They do,
Yeah.
and they're expected to attend every event on behalf of their country and everything. Like
Yeah.
it is actually hard work.
Yeah,
and
physical
so
fitness.
To be
some-
Miss Universe for the year, yeah, it's not
and
easy.
then but even like they're Miss Canada or Miss whatever, so they get to that point and they're in that moment, and you're waiting for your moment, and all of a sudden you have your moment, and then it's like, oh no, it's not your moment, it's
Wow.
it's her moment.
But did you see how
Wow.
refined she was afterwards? She said,
I
I'm
heard
both.
still very,
Were they?
very happy. She
Yeah.
said, whatever
Yeah.
is to be is to be. It's a mistake. I'm very content that I was where I was and
Yeah.
that they thought it was me. How graceful.
Yeah.
She was
Yeah,
a clone
she
of
was.
Sofia Vergara,
Yeah.
would you
Oh,
say? She
yes.
looks so much like
Yes.
her.
No, not a little bit. A twin
She was
sister.
a twin, like Baba
Easy.
Vroom.
Easy.
But I was just mortified when he said, and he had to say, it's my mistake. I take full apology. He showed the
And he
card.
showed the card. He
With
did,
the
and
runner-up's
it's-
name on it.
Yeah.
And he misread it.
It was.
Woo! I would just want to put my bag
wow.
over my head.
Yes.
And it's so hard for Miss Philippine to
Take
she
the
wanted
crown.
to smile and be happy, but yet they were taking it off this other
I know.
from one
I know.
woman and putting it on another,
know.
and like, how are you supposed to be so happy for
know,
yourself?
you
I heard
Definitely.
both women actually
Yeah.
were incredibly gracious,
They were.
and I heard that Miss Philippines kept looking to Miss Columbia to see if she was okay.
I don't blame
Yeah.
her.
You know?
I
No,
think I'd have
that's
to let her
just
say,
it.
you would keep the crown. I think
I'd
I
even
would.
heard the other woman who was announcing say something along the lines, "Is she going to give up the crown?" And I'm like, "It's not."
Well, you go back
hers.
to Miss Congeniality. Did you see that movie? And like
Horrific.
there's a fist fight at the end, and she's
Yes.
trying to pull the crown off the other one's head. It kind
Yes.
of, I thought
Sandra
of that for a minute.
Bullock.
Wow.
Yeah. I love Sandra Bullock. I kind of
Yeah.
thought of that for a minute.
Yep.
Exactly. So if you got a chance to see that, if not, you
It's all over
definitely
YouTube.
It's
It's all
history
over YouTube, Facebook. I picked it up there. Exactly. That's just it.
Yeah.
Other things happening a little closer to home. Dennis Oland was his verdict come down. He was convicted of murdering
Yes.
his father.
Yeah, second-degree
Found
murder.
guilty.
Yeah, for
Yeah.
sure.
People were
But
shocked. I wasn't
It's been
shocked.
a year or 2 years.
4 years.
2011.
It's been, oh,
4
wow.
years
Took
since
that long.
that happened.
Yeah, 2011.
Oh, you're kidding.
So
Okay.
it was in his office. Richard Oland of Moosehead Breweries, and a well-known businessman, apparently worth about $36 million.
Incredible.
And there was some talk of money issues with the with the
Yeah.
son,
Yeah.
and like some really rival nature there between the
Yeah.
father and son.
Yeah.
And there was a lot of stuff, but Richard Marquis, actually, it's Greg Marquis. Greg Marquis is writing a book about it,
Oh,
and
really?
he was in shock.
Really?
Actually, at the verdict.
Really? And I didn't follow it closely. I really didn't. I did, you catch glimpses of it as
Yeah.
on
Few
your Twitter
details.
feed and that. But I guess I wasn't surprised, because it just seemed like everything that was being reported, pointed that way.
Yes.
But like I said, I didn't follow it closely. But
No.
everybody that I know is really shocked by the verdict, and even his family and his close and extended family came out to say that they really did not believe that he committed the murder. And I think I read this morning that he's already
Going to
appeal. Yeah.
Appeal.
But our very own Jack Walsh, John Walsh, is
Right.
his real name. He goes by Jack Walsh. He's the Court of Queen's Justice on the bench, and he is famous for being a DNA expert.
Okay.
And he told them the jurors, they had to prove guilty beyond a reasonable doubt.
Yeah.
So the 12 of them all agreed that he was guilty.
And that's amazing.
Yeah.
Yeah.
It was a unanimous decision,
Yeah.
right? It
Yeah.
wasn't.
They had 47 witnesses,
Yeah.
so that's a lot of witnesses to this, and 236
I'm not going to
exhibits.
say boo because I did hear some details, but everything I did hear leaning towards him being guilty.
Now,
so I
the
didn't hear the
sentence,
other
he's
side.
supposed to be sentenced in February, and it carries with it a mandatory 10-year sentence, or carries with it a mandatory life sentence with 10 years minimum before he's eligible for
Right.
parole, was the recommendation by the jury. Now, what they decide to
what
do
they
with that
decide to
is, we'll see.
But he
Exactly.
wailed when they gave the
Yeah, I
verdict in
heard
front of
that.
his
Yeah.
wife, and he was
Oh. I heard
wailing
that.
and
I
saying,
heard
"Oh
that.
no, oh
Uncontrollably.
no, oh no!" Yeah, he just lost it completely.
Oh, really?
He has 3 children and a wife, so they're all in mourning, definitely, and away he goes.
No,
Yeah, terrible
exactly.
stuff.
No, that's just it. Another little story that hopefully will turn out to be a little more positive. The Minister of Health is revisiting their decision with little Morgan Doucette and his health care and looking after his treatment.
Yeah, they are.
So-
They've decided to revisit the decision. Apparently the Minister of Health is consulting experts to see, what they think. I read one report, and I don't know if it's accurate or not, that they felt that perhaps the treatment wasn't going to do what they felt it was going to do,
Okay.
which is why they denied the treatment.
Okay.
But it's hard to say, though. Really,
No.
I'm glad that
Because they would have their protocol that they have to
They do,
follow.
yeah.
You have to meet
Yeah.
that requirement.
Yeah,
And
I'm glad they're revisiting it, though. I think
Yeah.
it's a tough decision to make. I think they're constantly
Yeah.
in a tough decision-making process. But really, when you're talking about a 10-year-old child, I don't think there's much that any of us wouldn't do.
He's the only
No.
one in New Brunswick,
Yeah,
right? And one of
exactly.
33 in Canada.
Exactly.
Yeah.
So can I
that's
ask you
right.
girls a question? A thought I have just as we're
Okay.
sitting here, it just
Okay.
came to my attention
Okay.
in my head. Why would you not think that the pharmaceutical companies might just get together and give them that drug? They have every access to what he needs. And just to make an exception for one child, I think they have the power as a pharmaceutical company with their head office to say, yes, this is one child in New Brunswick, and why not this time?
Yeah.
They have the resources.
They have the power to do that.
To dispense it, exactly.
Yeah.
And I think you're right. I think, you know, and there's so much in the news right now about pharmaceutical companies because of the CEO, the 32-year-old CEO who jacked prices by 1,000% on medications
yes.
I believe it was cancer medication, and
yeah.
was so cocky about it. And just actually this weekend was arrested on fraud charges.
Oh,
which,
wow.
you know, sometimes that happens, right? Karma, you get to see karma in action.
Yes,
Wow.
But, and I hate to say that because I don't want karma to bite me in the bum, but
No.
No.
But you hear so much about drug companies jacking prices on unnecessary medications, and they're making billion-dollar profits while most companies are struggling to make profits at all, and they're making billion-dollar profits every year. So you would think that there should be a requirement to do some corporate responsibility and give back.
That's my thought.
I do
That's
too.
my thought.
I totally
and I just
agree.
wondered if you were in agreement with me.
No, I would. I can see it. They would be bombarded with numerous cases that would come forth wanting the same.
But if it's a one-time thing in New Brunswick, how often is that going to happen? That's one
No,
of 33 in
rare.
Canada.
Yeah,
that
exactly.
rare.
That's
That rare.
it.
There's
To me, I
7,000 rare
think
diseases.
I'm along the same lines with her in the fact that the pharmaceutical company should definitely, if it's something that's required in order for you to stay alive,
Yes.
there should be a discount, a kickback, something.
Yeah.
Well,
No, I think
1,000 jacking it up 1,000%
Yeah,
more
and he
than
was-
wherever it was already.
And he was very, very, cocky about it. That was, and he was just one CEO. He's 32 years old. He was one, CEO talking about that kind of thing. But it shocks me sometimes at how expensive medication is.
Yes, it is.
No.
And I think
Exactly.
you're right, Judy. I think that there are only 33 cases in Canada, and he's a 10-year-old boy.
Yeah.
And like I said, there isn't much that we wouldn't do as human beings
No,
for a
no.
child.
So in our pharmaceutical companies within New Brunswick
No.
to just dispense the amount of medication
What
needs
do
to
they
me is
do
no
to-
huge hardship.
Do
We
they
have to
do
buy
any
it.
forms of giving back or charity
not
or
know.
anything?
It's hard. I mean,
or-
yes,
know.
they
Probably
would.
must,
They do.
but
It's hard
We'd
to
like to think.
We're not talking about an antibiotic that you can get for a few
that's
dollars.
right.
You know?
No. We're
Yes,
talking
something.
But
there.
luckily, and very thankfully, the Minister of Health, Victor Boudreau, has decided to revisit
Yes.
the case. So hopefully, the outcome will be what we're all hoping for, which
Yeah.
is that they'll do what
I feel
they
like
should be
the
doing.
markup on drugs and medication for conditions that are life-threatening or to stay in life or to extend life, is that where the percentage is higher?
Yeah. Well, that's because they know that they need to make the money, right?
And I'm like, can I start doing that in my business?
No.
No? I'm like, okay. But
I'm trying
anyway.
to figure out how I get a marijuana dispensary.
Yeah, drive through the restaurant.
Well, it's going to be legal.
Yes, it will be legal soon.
The brownies will be legal.
That's true. That's true.
You can sell
Yeah.
brownies
Oh,
on my
I'm selling
land.
pot brownies. I'm not, by the way.
Yes.
Everyone.
No,
Let's just be
exactly.
clear.
Yeah, their Facebook page just blew
I know,
up.
yeah, let's just be clear. I am not selling pot brownies.
No,
Okay.
she doesn't have a license yet. That's the only reason.
Oh my goodness, I can just see my Facebook
Oh,
newsfeed
no.
now.
Speaking of not, we're on the countdown. How many days? There's 4.
This is the 20th.
How many sleeps?
Right?
Yep.
4.
Monday,
4?
Tuesday, Wednesday, Thursday. 4 more sleeps.
That's why my voice is like this. I'm worn out.
I'm
worn
pooped.
out from shopping,
I
wrapping,
did.
trying to get things done at the house.
Yeah. 5 hours of full-on shopping yesterday. Like most stores were open from 12 to 5. I was out there. And then, 5 hours of wrapping last
Isn't that
night.
brutal? I hate wrapping.
And, I mean, where are you guys with all of your prep for Christmas? Is there people like me who are still not ready and
not
will
done.
not be
I'm
ready?
not.
I'm ready,
Okay.
except for stocking stuffers and delivering to people. But I was so sore from wrapping and writing out and bending and lifting and cutting and just the movement of your body for about 8 hours the other day. I couldn't even walk.
I can't sit to wrap. I have to be standing at a table. If I
stand too.
sit down, then I'll be crippled.
Yep.
There'll be no walking.
See,
no nothing.
in my previous career, before I moved home 10 years ago, I was the education executive for Estee Lauder Cosmetics for Quebec and Eastern Ontario. And part of my job every year was teaching our beauty advisors in store how to wrap. I actually taught wrapping gifts.
Okay.
And so that
Like shortcuts or
no,
all that fancy
yeah,
pretty stuff?
like that was part of my job. That was part of my job. Is I trained beauty advisors in how to do makeup and all that stuff. But part of it was how to make a gorgeous basket, you know, but also how to wrap a gift.
Well, you could teach me.
And ever since then, everybody gets their gifts in bags from me because I just don't do it.
refuse
I just
to
don't
go
do
back.
it.
It's a lot of
to-
work. And I
It
always
is.
get something odd
is.
to wrap. I always get something that's really odd, like
Yeah.
the end
No.
falls out or
Yeah.
something
No.
doesn't, you know.
My
it's just-
first few gifts are gorgeous.
Yeah.
And then you can just tell
Yeah.
as you go along
Little
where I'm
tape.
at with.
But we have
with
a
the wrapping.
relative, Aunt Beth,
Yes,
your
my
sister-in-law, my
sister-in-law.
aunt. She truly is gifted at wrapping.
Beautiful. She loves
She
it too.
enjoys
And she
it.
loves it. But like you get these beautifully elaborate gifts.
Bows are
The bows and
incredible.
and it's all you really
She
feel.
makes me sick. I don't mind saying it.
You really feel when you get the gift, just getting the gift is
Gift
really
was-
something.
I don't even want to give her
I
one
know,
after that.
I
It's
know.
like, Jan, my kids wrapped this. My dog wrapped it. My dog wrapped it. That's my new.
I put it in a bag.
It's okay. But I'm pretty much there now. Yeah,
Yeah.
I'm
No,
pretty
I'm
much
not.
done.
Well, I feel for those parents. Remember last Christmas we chit-chatted about how I got sucked into the elf on the shelf?
Yes.
I'm like, I don't know who's watching this. I don't want to spoil it
my
for anybody.
sister. Hi, Colleen. How's the
I have to laugh. I'm reading the posts on Facebook, and one mom was saying something along the lines that my kids think that the elf on the shelf they got is broken because he's only moved 4 times since the 1st
He's
of
disabled
December.
right now.
But have you seen that list on Facebook of 25 reasons why the elf didn't move?
No,
And you can
there's
give those to your kids.
Oh, okay.
Like I was so exhausted from my flight back to the North Pole, and we were so busy I had to lay
Yeah,
down.
the delays.
Yeah, like
There was
there's
a
like 25
storm.
reasons.
Yeah. Yeah, exactly.
Cute.
Honest to goodness. So,
What's your favorite
but
Christmas treat? What's your favorite thing you have to
I've
have in
been,
the holidays
I
besides
have to
rum
have.
and Coke?
Yeah, that one's like that one's hers. I am doing. I love the Christmas Rice Krispies. I love the red and
Thinks I'm a big
green.
alcoholic.
No, you're not.
Pot brownies and alcohol.
I'm a big alcoholic.
Okay.
Sometime alcohol. No,
Well,
I'm
we'll
just joking.
save this
You don't even drink, you
conversation
just
for
she doesn't
another
drink.
show. We want to mention our guests that are coming up
Yes.
because we're going to be taking a short break. We have Jilian Dothery is coming up. Not next, but she's a dental hygienist who's going to be talking to us a little later on in the show. But up next, we have Kristen Copp, who is a nurse, and she is with Cardiac Wellness, who's going to be talking to us a little bit about the programs that she's involved with.
Two
here
beautiful
and there.
blondes set up to
Yes.
make the stage
I
here.
know it's true.
The set.
No, definitely. So there's a lot more show to
Yes.
go, lots to talk about. So we don't want to go anywhere. We want to remind our viewers that not only are we on Facebook, you can find us on YouTube as well. Full episodes if you don't get Rogers. So don't
at
go
like-
away.
look
We'll
at
be
Rogers.
right back with Have a Chat. Welcome back to Have a Chat. I'm Audrey Lynch with my co-hosts Judy and Veronique. And joining us now we have Kristen Copp, who's a nurse at the Miramichi Regional Hospital, who's with the Cardiac and Wellness Program. Thanks for joining us.
Thank you for having me.
Thank you for
Tell
coming.
us a little bit, Kristen, about who you are and all of that.
So I've actually been a nurse for 14 years now. Before starting and I guess working with Cardiac Wellness, I worked in CCU, which is the chronic care unit at the hospital, critical care unit, at the hospital. From there, I worked there for about 5 years, and then since then, I've been working with Cardiac Wellness. So the two really mesh well
Yes.
together, and being able to provide the patients with that previous, chronic phase to the, of course, more rehabilitative phase and stuff. So, yeah.
People will be interested about this program. So I understand that Dr. Ziggy, he goes by Ziggy Novak,
Yes.
is the physician that leads this clinic.
Yes, he is. He's the medical director
Yes.
with Cardiac Wellness. We've actually been providing this service to the Miramichi citizens for the last 10 years. This is our 10-year anniversary, 2015. It's our 10 years. Yeah, so it's very exciting and nice to be embarking on the 11th year, I guess, in
hard to
2016.
believe.
I
Hard to
know,
believe.
very hard to believe. Yeah.
I'm going to get you to just scoot in a little
Yeah.
bit more. We're all seeing. We don't want to miss a thing here, so we can hear and see everything.
Yeah.
So, go
I
right
just want
ahead.
to know more about the program,
Yeah.
like what it involves for a patient from day one that you see has an issue that you deal with, and then from their diagnosis to what takes place after they visit you.
Okay. So typically referral happens by automatic referral from St. John. So anybody who may have a heart attack, bypass surgery, valve surgery, anything like that that would go to St. John for investigation, we go to automatic referrals from the surgeons there. We do get referrals from family physicians here in the area for people who have had these issues in the past or currently dealing with some maybe risk factors such as high blood pressure, inactivity, cholesterol issues, different things like
Diabetes?
that. Diabetes is huge,
That's huge,
right? It goes
isn't it?
hand in hand with heart disease.
Really?
We do a whole show on that.
Oh, I didn't know that.
I didn't either, and
Yeah.
it's funny because we don't have a history of heart problems in our family. So, and I know that's not the only factor, but it's never been a huge worry for me. But diabetes has been, and now that I know that they're together, that's worse.
Yeah, it's just the actual progression of diabetes itself and how it attacks the vessels and the major organs and things like that we end up having secondary issues with heart and of course visual, brain, the whole 9 yards. Yeah.
Wow.
Yeah.
Well, what do we do at a younger stage? Like, there's none of that going on, but what would I do at preventative measures or things to keep an eye out and look for in case, this is something that would become an issue?
Right. So that's something that we talk to patients about all the time.
Instead of waiting for something to go wrong first.
Yes. Prevention.
Preventive.
Yes.
Exactly. And that is so key to I guess, preventing the progression of any illness and things like that, or, going through an event. So whenever you look at what you're wanting to prevent, you want to look at your modifiable risk factors. So those are the ones that you can change, that you have some influence over. And then you want to look at your non-modifiable risk factors. Those are the ones that, you don't really have any control over.
Yeah, they came with me.
Exactly. So your modifiable ones would be ones such as if you had diabetes, keeping your numbers under control. If you had high blood pressure, making sure your blood pressure is well controlled. If you had cholesterol issues, making sure your numbers are well controlled as well. Getting enough physical activity. The new recommendation is 150 minutes of cardiovascular exercise a week. You don't have to do it all in one day.
No.
And it's nice to kind of break it up into little bits and then attain that 150 during your 7-day span, right?
Yeah.
I always joke with everybody and say that's like a C on a test, though.
I'm trying to think what 150 minutes is.
So the 5 best
Yeah.
that I heard are brisk walking,
Yes.
running, swimming, cycling, and then your circuit training. So you would do just maybe 3 minutes of cardio and then a little bit of weight training.
Absolutely. So the key thing with it is that the recommendation is 150 minutes of cardio. So however you want to get that in, right? So cardio being moderate to intense cardiovascular activity. And then, of course, you want to incorporate resistance exercise. So circuit training, maybe just lifting some, 10-pound dumbbells whenever you're, sitting even watching the news or the show.
Well, of course they're watching the show, obviously.
You want to incorporate at least 3 of those sessions a week, 2 to 3.
Okay.
And that session should be about a 30 to an hour time frame. Okay, so being able to incorporate those things are really, really important for, of course, prevention of cardiovascular illness and many other illnesses as well. Like when you're thinking about blood pressure control, not wanting to end up having to deal with blood pressure, that's one of the biggest things right there is just moving a little bit more.
That was going to be one of my questions, is about the myths and stuff that people believe actually cause or don't cause, or that, like initially in my head you're talking about high blood pressure. Well, I've always been told I have normally low, so I never worry about salt intake. Not that I use a whole lot. I don't worry about water a whole lot. I keep thinking I'll never have to worry about heart problems because I have low blood pressure.
Right.
So is that a myth? Is that
I would say that it's always good to be aware of a risk that you may have. So if you have lower blood pressure, of course, you're not going to be really strict watching yourself. For example, you're not going to be like, okay, I can only have 1,500 milligrams of sodium a day. I have to get 150 minutes this week, and I have to weight train, and you wouldn't be maybe so strict with yourself. But it's always good to kind of pay attention to those things, because blood pressure is one of those things called the silent killer.
okay?
So
Whether it's too high or too low.
Well, up too high, right? So it can creep up quite quickly on us, right? Without even knowing. We have no symptoms of high blood pressure. So, that's the classic example that I always give. A man waiting while his wife is in the pharmacy, sticks his arm in the blood pressure machine, and lo and behold, it's high, and he's like, what the heck?
So why would it fluctuate? Why would it go up and down, up and down? Are there reasons for that in a person?
Oh, absolutely. So even myself here. So sitting and resting, my blood pressure is probably A1. Maybe under a more stressful situation where your adrenaline's up a little bit more, your blood pressure is going to go up. Yeah. When you're exercising, your blood pressure is going to be going up. From sitting to standing to lying down, your blood pressure fluctuates all the time.
I was just thinking of a gentleman I know very well, and it goes from really, really high to moderate to low, and really, really high, and it goes all day long up and down.
Yep, absolutely.
I always know when my blood pressure is going up, and I don't have a problem, but I do know because I start to get hot, and then my head and I start to, and I'm like, okay.
Stress.
But now you said that a family doctor can refer you, or you can come from St. John. Can a person like myself? Can I refer myself? Can I?
Yeah, so absolutely call. But what we'll end up doing is talking to your family physician. We like to keep it very focused so that it's physician referral. That way we have more of a good communication with the family doctor or the internist and things like that too. Yeah, so it's nice to be able to be referred by your family physician and things like that to kind of keep within that consistency.
And then you've got the follow-up as well.
Absolutely.
I know that you're going to say, without a doubt, that one of the key components of cardiac wellness is diet.
I was thinking the same thing. I'm like, I'm waiting for her to hit the nutrition part of it.
I'm not a nurse,
at this time of year.
It's
but
Christmas.
we have to talk about it because it's true, right?
Oh, it plays a very huge role. It does. But whenever you're looking at getting back to those modifiable risk factors, again, diet is one of those things. So our fat, our saturated fat, our sodium intake, our portion control, or caloric intake, all those things absolutely make a huge difference. But then you also have to look at stress. Stress is a huge thing when it comes to cardiovascular illness as well, right? So it's all of those things that really make the big picture. And it's good to inform patients of that. But yes, without a doubt, when we provide a program to patients, half of our program is given by the dietitian that works with the cardiac wellness program. Her presentations start from label reading. I always say if you can read a label, you can make a really good decision. Right? Either leave that product where it's at or bring it home with you.
Usually it's leave it. Usually.
Take your reading glasses with you because they don't make them very big anymore.
And two, it's starting with that. So, and then of course we get to the food guide, portion control. That's huge, right? So typically our plates are growing and growing and growing.
They have been, Have you bought a set of dishes lately? The dinner plate's enormous.
Yeah.
So it is. On there. So do you have a team? You must have a whole team at the Cardiac Wellness Center.
Absolutely. So our team is composed of myself, which is the nurse. Dr. Novak is the medical director, like I had said before. There's also the pharmacist. He provides a session on medications. Medications are typically much the same for most cardiac patients. It's the cardiac cocktail almost, right? So, and he gives a really detailed presentation on side effects, different things to look for, medications that might be interacting with each other, things like that.
Perfect.
We also have the dietitian, like I had mentioned as well. Her presentations, of course, start from the beginning of learning how to eat or modifying the way we're eating to the progression of that. So, what we eat and kind of getting down to the basics of maybe why we consume too much or why we're driven to have that higher caloric food and things like that, right?
Because it tastes better.
I know.
Of course, I'm appalled when I see people with their salt shakers just pounding the salt on food.
I never ever did that.
It scares me.
No,
I don't either.
I'll cook with it. I'll cook
bit.
with it and stuff like that, but I was never one to.
I do salt my
take
food,
the
but
salt and
not
pepper.
like it'll be like a
Oh, I see people do that, though. It scares me.
Dad, and Dad's like that, to be honest.
I would have to say the older generation, definitely
Salt
the salt and pepper had to be on the table, and it was just.
I love pepper.
Oh, pepper's great, but that's
when
the
they load it
staple.
on.
It's on every kitchen table, right? The salt and pepper.
Automatically.
Yeah, so we
That's
kind of
just
go
it.
through two things of how to season your food with different spices and stuff like that. What would go with pork, or what would go with beef, or what would go with fish. So it's nice.
So the dietitian can give them all that information
Absolutely.
Exactly. Well, what about
Absolutely.
somebody on your team that deals with teaching them the exercises and stuff that we talked about
Yes.
as well? Because, I mean, you can give me this whole list of
Yes.
things that I should do, but are these patients able to go back and you check up on them and you know that they're doing everything right?
Absolutely. So after they are enrolled in a program, right, the physiotherapist plays a huge part in our program because they more or less sign up for a 10-week program or
Okay.
a 12-week program, which is consists of an hour of education and an hour of exercise twice a week
Perfect.
with us at the hospital.
Wonderful
There.
program.
It is. It's great. It's a slow progression of physical ability as well. So people start out where their baseline is, and we're able to help them grow from there. Everything is done on a safety factor, right? So stress test is very important prior to starting the program so that we can provide people with good target heart rates. And what I mean by a target heart rate is a heart rate that is given to that patient based on their stress test. Okay, so we're not over-exercising anybody or under-exercising, because some people might be like, well, you know, I don't want to push it, you know.
So a stress test physically is a physical test. It's not necessarily mental or
Get on a machine
blood
and
work.
run.
It's
On a
actually
treadmill.
physically. Oh, it is. Okay, so it's the same. When they say
Yes.
stress
Yeah.
test, it's the same.
It's to
across
see
the
how
board.
your body reacts under stress, like physical stress.
So if you're out
Physical
of breath after 1 minute, you're not in great shape.
Well, and they're looking to see kind of what your heart is doing as well.
Okay.
So you're hooked up to the ECG machine and stuff, and they're trying to evaluate kind of your physical condition along with your heart condition, more or less, is how your heart is responding to the stress.
Because I would think, too, a 20-year-old should respond better than, you know.
Someone my age.
I
Yeah.
wasn't
Say it.
going to go
Say it. I
there.
dare
I
ya.
wasn't going to go there.
Come on, Audrey.
I'm saying I'm
I'm
that one.
mature. And then someone who is older, because I would think that, you know, their ability to handle, they're not expected to be able to full-on run and have that kind
But
of endurance.
yeah, and you're right.
But
But if you look at my dad,
Yes.
right? Okay,
Yes.
Dad just had a
There's
stress
exceptions.
test.
Okay.
And so Dad, he's going to kill me, just turned 70 last
Okay.
year,
He's going to
2 weeks
kill
ago,
you.
2 weeks ago, and he has the heart of a 20-year-old.
Nice.
Like
Super
he,
active.
yeah, like he can outrun, you know, just about anybody, right? Like, and he's always stayed in shape.
Wonderful.
So it just, and he's always eaten well, and he's
Yeah.
taken care of himself and done all, but he salts his food. And that comes from living in Africa for 17 years and having to retain water, right? Because it's so hot.
Exactly.
He salted his food.
Okay.
And so that, and eventually stopped sweating. That sounds odd, but anyway, so to retain water, right?
Okay.
To retain moisture in that environment.
That would be totally why I probably don't sweat. I'm not a sweater, but I don't drink water.
But he still salts his food.
Okay.
Okay, you don't have to retain your water anymore. After that.
So, Kristen, heart disease is the #1 killer amongst women, isn't it?
Absolutely, men and women.
Men
right?
and women, it's
Yes.
number one?
It's still number one.
Yes, it
But
is
women
still
don't pay
number
attention.
Women are that wild card, is what I always say, right? So women never present usually the same way as a man either, right? So sometimes women will have right-sided arm pain. Maybe, you know, it might be more in their jaw,
Yes.
maybe in their back between their shoulders.
Really?
Yes, I've heard that.
So women are the wild card in which there's no firm, okay, you know, sternal chest pain like an elephant sitting there down the left side of the arm, right?
Well, because
No,
we all,
exactly.
you all wait for that.
And we all think it's a sharp pain,
yeah.
and it's not. It would
Not
be
all
more
the
of a
time.
It can be
Exactly. And it can present itself in so many different ways. I know there was one lady who had a mammogram a day before, came to the emergency department the next day, and that was the way that her chest pain was presenting itself as breast pain. So, yeah, just to be aware of those things. I always tell people that, you know, if you're suspicious of anything, definitely have that open conversation with your family physician and have those things investigated, especially if you have, you know, a high risk to being, you know, a cardiovascular patient.
So, am I allowed to ask, would you have the availability to tell us what numbers we're dealing with in the Miramichi area for heart patients, issues? That they have?
So, right now, we have probably about 80 people waiting for a program on our waiting
Wow.
list. And that's just the people who know that they have heart disease, right? They know they have a cardiovascular problem.
And they're looking to get in on the program
Right.
too, because there's those who are
Exactly.
still in denial
or the
whatever
primary
case may be.
people, right? So primary prevention comes to those people who know that maybe they have a risk factor or something like that, but they've never been diagnosed or they haven't had a heart attack yet. So those are the other part of the population, you know, that we want to reach out to as well. So, you know,
Is there an age group specifically that you're looking at in that number of 80?
So we have anybody from the age of 30 to the age of 82.
30 to 82.
Yeah.
So it really can be any age.
Absolutely.
Yeah.
Absolutely. And we're seeing younger and younger all the time. Those things are starting to creep up. High blood pressure is starting to creep up at a younger age.
Yeah.
We are becoming a more aware population and more physical
A lot of
population.
gyms in the area now.
Yeah.
Physical fitness place. I'm so
Yeah.
happy about those facilities in place.
Exactly.
Yeah,
That's just
yeah,
it.
which is great, which is
Yes.
fabulous. Absolutely. Absolutely.
Yes, especially because we were the most obese city in the province there for a while.
Yeah, we
and
were-
in Canada,
we were up
were we
there.
number 1 at one point?
Yes.
In Canada.
Yep.
That's not something
Not
to be
that
proud
long
of. It's not something to be proud of at all.
No, but I think, like, and I always tell the patients that you can really capitalize on the good stuff because really, in all actuality, people are moving so much more these days.
Yes.
Yes.
They're involved in different things. You know, there's many different physical programs available to people now in the Miramichi as well.
Yes.
Whereas I remember when I was younger, there was nothing. There
made
might have
your
been
own fun.
Yvonne's gym was the only
Yes.
gym.
Yes.
You're right. Yeah.
Yeah,
you're
there's
right.
a lot more choices out there because there's so many different things. Going to the gym and lifting weights might not be your thing, so there's
Jogging,
CrossFit,
running clubs.
there's cycling, all of that. So
Yeah.
there's so much more available out there
variety.
to
I'll
us.
give all that up this year.
New Year resolution.
Yeah, stop being so active
Exactly.
physically.
Well, we want to thank you so much for joining us, Kristen. You gave us a lot of great information there. We want to let people know how to get a hold of you. So you're at Miramichi Regional Hospital.
Yes.
And the Cardiac Wellness Program.
Absolutely.
So thanks so much.
Thank you.
We'll be
Extremely
right
valuable.
back with more Have a Chat. Hi, welcome back to Have a Chat. I'm Audrey Lynch, and Judy and Vero are still here with me. Can't get rid of them. No.
It's true.
They're
We're
hanging,
not getting
glued
rid of
to
us.
their seats. And joining us now is Jilian Dothery. Thanks for joining us.
You're welcome.
Now, you are a dental hygienist and working at or with Miramichi Smiles Family Dentistry. We have a lot of questions for you, I think.
I'm all excited.
I love to
Beautiful
educate.
smile.
No, well, tell us a little bit about yourself first.
So I've been a dental hygienist for 3 years, and I struggled to come to Miramichi. It's a really hard spot to get a job. So I actually worked at 9 different clinics for the last 3 years.
experience.
Oh,
Yeah.
wow.
It's almost like supply teaching if you're sick or you couldn't fill in. And I made a full-time job out of it, but it was a
Great.
lot of traveling and, learned a lot. And then these 2 lovely people, Dr. Shear and Dr. Hairbottle, actually bought, it was Martin Terrio's clinic.
Right.
And they wanted a fresh face and
And a pretty face.
and here I am. Yeah. And I love it. Yeah.
Poster
Beautiful
child.
teeth.
Your teeth are
I
wonderful.
was going to say beautiful teeth.
Thank you.
So an example, actually a walking example of what
Well, I
teeth should
floss
be.
and brush twice a day. And I
Okay,
do my routine.
And that leads into the question. So, should you floss and? I mean, I brush because I don't want anybody near me. But should you brush and floss twice a day?
Yes. So daily routine, what I would tell my patients is, we want you to brush definitely twice a day. 2 minutes is kind of your timer or a good song.
2
I always
minutes.
tell people, put on a song. Don't make it a classical because they're long.
Did you see the toothbrushes that come out a
The
couple of
timers?
years that had music?
Yes.
Which
Wow.
They had the
Yes.
song playing.
Yes.
I got that for my
That's
kids.
cool.
It's genius.
But mine
Yeah.
has a timer. Mine's I have
Yeah.
an electric toothbrush
Yeah.
and it has a timer on
Yeah,
it. So
which
it
is great.
stops.
And then flossing, flossing is really important, and I don't think many people really know there is a technique to flossing. So,
I realize there is.
right?
There
Yeah.
It's a long job.
It's a
I
long-
find it so time consuming. I would rather have a root canal, actually.
So yeah,
I don't
you
like
really
it.
gotta. It doesn't have to be a 2-minute process, but it probably is for me. I'm a little bit
Me
more,
too.
OCD about it. But you really have to take the time, wrap around each tooth, and get in there. You're not just going in there to take food and the steak that's left behind.
Stop.
You want to get under and get the bacteria under your gums.
I don't
and-
think I wrap.
Christmas.
I
Yeah.
floss, but I don't
You
wrap.
kind of go
Down
in. You're,
into the
you
gum,
remove
right?
the steak. You
I
remove
do.
the steak,
Yeah.
right?
Yeah.
Yeah. So no, you want to go under your gums, and it does look like you're right.
You're cutting and bleeding.
Yeah.
And
So healthy gums don't bleed. I had this fabulous teacher,
Okay.
Stephanie Bradley. I'm giving her a shout out because she taught us healthy gums don't bleed. No matter what you do, I'm taking a sharp metal instrument under your gums and I'm not making you bleed. So, you know, if your gums are bleeding, that's gingivitis. The bacteria
So
has
what about
infected
hormones?
you.
So some hormones or
So pregnant women.
Pregnant women.
I love this. This is my favorite.
Oh, I'm not pregnant. I mean, that's not why I brought it up.
No. But there probably is out there watching.
There is, and I don't think that, you know, with everything that goes on and the lovely things with being pregnant, nausea, and all that great stuff, you don't realize that you do get a super aggressive bacteria that only happens when you're pregnant. Very hormonal bacteria can cause bone disease, so breakdown of your bone, gum disease, poofy bleeding, all that good stuff. So I actually have my patients come in, and based on what I see, I'll recommend coming in even 3 months rather than 6. Let's stay ahead of it, because maybe you're nauseous and you don't want to brush your teeth really well, or you don't want to stick your fingers in your mouth and floss. So come to me, we'll clean it up, and it'll help. Yeah.
So is it true that you can reverse gum disease?
Yeah, so gum disease, gingivitis specifically, is bacteria under your gums, almost like a little splinter under your skin. It's reacting. The inflammation process is occurring, and you're bleeding, you're poofy, you know, they're sore to touch. Once you leave that, though, and it starts to break down your bone, that's yours to keep. The bone you lose is yours to keep. I mean, you can go to specialists and that sort of thing, but
That's right.
so I always tell my patients that come in, this is reversible. Let's stay ahead of it now and not let it get to where it is. And if it is that bone disease, we deal with it appropriately.
Like a periodontist.
Periodontist.
But does brushing and flossing keep gingivitis away
Yes.
100%? And I
100%.
never have to scoot out to see you?
Oh, no, no, no.
Oh, no,
You
I
need to
just
see
said-
us. No.
Okay.
So regular maintenance, see us every 6 months, okay?
Okay.
So for us at our clinic, I actually really love this clinic for multiple reasons. We do cancer screenings at every appointment. We feel your lymph nodes. We tell you if you see any red or white lesions or any bumps or lumps that don't go away in 2 weeks, contact your physician or us, and we'll refer you.
Or a sore or something
That's
inside
right.
your mouth.
The second thing we do is we check blood pressure at every visit. So we want to let people know that, you know, as Kristen was saying, high blood pressure means your body's unable to fight bacteria the way it should be fighting it. Okay? So if you come in my chair and you have elevated blood pressure, I may not be able to treat you. I'm stirring up all this bacteria. Look what it's doing to your gums. It's going directly to your heart, causing different situations.
Oh my goodness.
Oh my goodness.
Right?
Oh my
So
goodness.
the third thing that we do is regular recalls. We want you in every 6 months. There's very rarely a patient, and I'm not saying they're not there, but that can come once a year. Very rare. It's, you know, I go every 4 months as a dental hygienist, and I'd like to think that I floss and brush pretty
Well,
good,
ma'am, yeah.
right? And I go every 4 months. So, I mean, I encourage my patients to come more often.
So just a stupid question, I guess. I guess there's no such thing
No.
as a
No,
stupid
no,
question,
no.
but
No,
what
no.
types of brushes should individuals with particular types of teeth use? An electric toothbrush, soft, medium, or hard bristle?
So never medium and hard, throw them out, discontinue.
Never
I
medium or
hate
hard.
that stores even sell them.
Okay.
What brushes your
Why
teeth?
would they?
They sell them because people are buying them. The same thing as whitening products. People are buying whitening products, okay?
They sure are.
Whitening is just abrasive. It's not bleaching your teeth. It's removing stain, but we don't have stain on our teeth. Not necessarily, so you're not really getting that whitening that you're buying. You're paying the extra $2 for, okay? But as far as brushes, medium and hard brushes can cause recession. Your gums, again, yours to keep.
recede.
Too rough on your gums?
Too rough on your gums. So
your
extra
gums
soft
will-
is your number one. Some people who really feel, you know, I'm not getting that
Yeah.
feeling,
I'm not
I say,
getting
okay, get soft or an electric brush.
Yes.
They're phenomenal. They're
Electric.
actually
all of
phenomenal.
them.
I love my,
Yeah.
I love
Right.
my electric brush.
Yeah, so I always say soft. The electric brush is what I use. I think if you use the proper technique, and there is a technique, we want you to really angle your brush up under your gums, wiggle, wiggle, sweep. It's so childish, but
Now go
it
over
works.
it. You go over it.
Yeah, so you take your toothbrush, you want it on a 45-degree angle towards your gum line. You want to kind of imagine the bristles are going under your gums and taking that bacteria out of there, wiggle it, and sweep it out.
Yeah.
Okay?
You're not just doing the surface. I
Not just doing the
constantly tell the
surface.
children, right? You have to
Yeah.
brush your gums, is what I'm
You
saying.
don't want to go on top of your gums,
No,
again, recession.
up underneath
So
it,
you
okay.
want to go under, right? The electric brush, I'm a huge fan of Oral-B for multiple reasons. If the head were to discontinue with Oral-B, the handle's still there. So it is an investment. They're not a cheap
Yeah.
purchase. So I do like to give credit to Oral-B for that. It's a long-term device, and there's a way to use that. You don't brush with that. Again, you can cause a lot of damage, so you want to hold it there towards your gum, sweep it down, and let it do, you know, the work for you. That's right.
Now, and I know that there's people at home, and I've gone through that because I go regularly every 6 months to get my teeth cleaned. But so if there's somebody at home and they haven't been in a long time and they're probably feeling a little embarrassed, and you know, what do you say to them?
Happens a lot. Thank you for coming. I'm glad you're here. You know, it takes a lot to come in when you're embarrassed. It does, and it is an embarrassing thing. People feel, you know, I have bad breath. I don't want her. You know, I mean, I have a mask and gloves on. I look at the worst of the worst. You are not the worst of the worst, and I hope that I make my patients feel comfortable.
Yes.
Because we have, you know, patients even that haven't come in 20 years, and they'll say, it's been 5 years, and then I'll clean their teeth. Okay, maybe it's been 20 years. You know, we kind of break that barrier.
I don't
a
let
little
them
bit.
do that.
Well, the thing is, for me, I'd have to say that because I was brought up that way. So you went once a year automatically with our family, and we had coverage. So we're going to talk about the money aspect of it, because I think that actually is a huge factor.
Huge factor. There
You know,
is
to
programs
getting-
out there.
Is there? Okay.
There was one, it was a tooth fairy program, and I wish I would have brought the name of the one they have currently right now. But when you make under a certain income, for children up to 18, they actually cover cleanings and dental work.
Yeah.
I know, and I'll have to give you the information for
you
you
can
can
post it.
post
Yep.
it.
Definitely.
It was a tooth fairy program at one point, but the government offers that. But you know,
because those first few years are the most important.
most important.
And you're
You know
right.
what I mean?
Big
To
factor,
teach
the
them
money.
those habits, and it's
Yeah.
true, because I would have to, when they recommend that this needs to be done or that needs to be done,
Yeah.
and I have to budget and figure out, okay,
How much can
what
I
has to
afford?
be done first.
That's
and
right. People in the
things like
family
that.
to worry about.
That's
No,
right.
that's
Prevention
just it.
is the key, though. I'm going to
That's
say,
right.
you know, for a cleaning, $130-ish can
Yeah.
go a long way, and a filling, you can come $500 or a root canal. You know,
Yeah.
it adds up. Dentistry is not cheap.
No.
There's no
because there's
question.
cosmetic ends of the dentistry
That's right.
program as well,
Yeah.
right? That people
so
go over
veneers
and
and
beyond.
that sort of thing. Yeah, but
That's
I mean,
just
as
it.
far as prevention and you know, cleaning out decay and that sort of thing, definitely pricey. But there are programs, and I think too, and I like to say to my, you know, some of my patients, you know, we pay an awful lot to get our hair done. You know,
That's just
it's
it.
a value system.
And
It's
what do you
where
look at? The
wanna-
first thing you see on somebody,
someone
basically, I go right to the
smile.
teeth. The
Yeah.
eyes, the teeth, or vice versa.
Yeah,
Yeah,
I do too.
exactly.
I do
So,
too.
Jillian, some foods that we should avoid for, like, to deteriorate your teeth.
Pop.
Pop's the big bad
Stop
one.
giving your children
Ah.
pop.
I don't
To
drink
me,
pop.
to me, it's liquid cocaine.
What?
People are addicted to it.
It's
It
like
is
liquid cocaine.
unbelievable.
It is for your
Well,
teeth, for your blood,
You'll
for
see
everything. I don't like
the
it.
brown decay all up along, not just children. You have the
No.
guys that walk around with a can of Pepsi in their hand or coffee with sugar
Coffee's
in their hand.
bad with sugar.
Yeah.
Anything
sip,
with
sip,
sugar.
Sip, sip,
That's
sip,
right.
sip all day long.
So here's what I tell my patients who are, you know, cavity-prone patients.
Okay.
Diet, first thing. What do you drink? Are you drinking pop? Are you drinking Gatorade? Sports drinks. They're probably the three number one killers because people are sipping them.
Not tea,
If you put sugar in it, but they're not necessarily as bad as you know.
pop,
That's right.
Gatorade, and what was the other one?
Energy drinks.
Energy drinks.
So here's, I
Sports
just saw on
drinks
Facebook, it was actually a dentist in the States who posted pictures of his young children patients, and he said, please stop sending your children to bed with a sippy cup with juice.
Yeah.
Oh,
And
Because
then
it rots
It
their
does.
teeth.
Rots their
Yeah.
teeth. No.
So I'll start with the cavity process. Really, you need sugar. So that's number one thing to think of. So if, for example, I enjoy a Pepsi when I go to Boston Pizza and have a meal, but I'm drinking that Pepsi with my meal, it's gone when I'm done eating, and I'll rinse with water. That's not sitting in my mouth. So for my Pepsi drinkers that come in, or you know, coffee or whatever, I say just don't sip on it. Drink it down. Neutralize your mouth with water afterwards.
Afterwards.
Okay,
Yeah,
that's
'cause it
one
lingers
acid
there.
attack. That's right.
That's just it.
As I'm drinking, my mouth hasn't started to remineralize, so it's one acid attack, one possible cavity. You sip it, your mouth remineralizes. You sip it again, it remineralizes, and it's a right.
It's a continuous.
That's right.
That's
So
just it.
now for kids, which again, super passionate about, parents don't realize a bottle puts them to bed, so they're leaving in, you know, milk, juice,
Yeah.
that sort of thing.
Apple juice.
Yeah.
Apple juice. It's called baby bottle tooth decay. It's an actual worldwide
Yeah.
thing
Yeah.
that's going
Epidemic.
on right now.
Yeah, exactly.
Water. Why not
Water.
put a little bit of water in there? You know,
water it down, throw it
don't
in.
even water it down because
Yeah.
there's still sugar in
Still,
it.
okay.
Right? So just water. Don't put your
No.
kids to bed with anything other than water.
Because you were talking when you had just said cavity prone, if you're cavity prone.
Yeah.
And how would you find that out? But I actually, out of the 4 kids, 2 of mine, I found out have
Acidic
thin
saliva.
enamel.
Okay.
And it was only from the x-ray we could see that the enamel, and I'm like, what do you mean it's thin?
no,
How can you tell?
yeah,
yeah.
And it was. So I
Yeah.
had 2 of them that
Yeah.
had to have all their baby teeth sealed
Oh, yeah.
because it was just an automatic. It wasn't going to make, not that it wasn't going to make a whole lot of difference, but when they're that little, you know what I mean? The crevices and stuff like that are so
and
deep
it's
in
so
their
hard.
molars and
It
stuff.
is. It is. You could have acidic saliva or basic saliva. So basic, you're more plaque prone. You're going to have the areas under your tongue where your saliva glands are, or up in your molars, are two really super big areas for getting tartar buildup.
Even though you brush and brush.
Even though you brush and brush. Acidity is going to be cavity prone. It's an acid attack if you think of it that way. So you can neutralize your mouth with baking soda and water, gargle with it. I know it sounds awful, but swishing with baking soda and water brings you back to a neutral, pH
I've heard
level.
that combination for so many health things lately.
It's phenomenal.
Well, and
Huge. And that's what our grandparents used to do.
Like, how do you what
Cankers
causes
are a
cancer?
pain in the butt.
I'll tell
Canker
you
sores,
why I
if
asked.
you've ever had
all
one.
of a sudden, in the last couple of weeks, I've had 2.
Yeah.
And
Stress? Stress. We
Your
all
body's
There we
immune
go.
system is down. Yeah.
I
But
would
I'm
have
like,
that.
what? And it was like, I had one week and then another the other. I'm like, that sucks.
Yeah. You know what? It's really just it's individual. Like I personally have never had canker sores until recently. I've been getting them a lot, and we bought a new home, and different
I love how everybody said stress at the
That's
same
right.
time and then pointed at me.
Some people let them go acidic food again. It just depends on the
Lemon,
person.
apples,
That's right.
oranges.
Yeah, probably.
I
Oranges,
get cankers when I eat
grapefruits.
too much oranges.
Yeah, anything like that. Yeah, I would say.
What do you think about Listerine and the mouthwash? What's your take on those?
So here's my caution with Listerine, only to the point I use it, I recommend it. My fear is that people will use it as a replacement.
Instead of brushing, that's it exactly.
So I don't normally recommend it to a patient until I know you're
They're
brushing and
already
flossing
brushing.
well.
Yeah.
Good thing to do.
To me, I tell the kids it loosens. It loosens so that when you go to brush, you know what I mean?
Yeah. So what my process is when I tell people to brush and floss, floss first, get all that loose stuff out of there. Okay. Yeah.
Floss first.
Brush and then rinse. That's my kind of. But here now, if you come and you say I've never flossed in my life, I don't care when you floss. Floss when you're watching TV. Floss, and I'll recommend the dental picks to people.
I was going to say,
You
that's
know,
what I
they
use.
don't go as deep. So if you
they
came in
don't.
my chair and
Okay.
you had a bone issue where you had 7 millimeters of bone loss, those picks aren't going to cut it, unfortunately, right? But you're going to come to me every 3 months. You're not going to come to me every 6 months, and we're going to, we have antibiotic rinses. I mean, it's a whole
Great in a
whole different
restaurant
thing.
after dinner, just go in the washroom
Just get in
discreetly,
there.
take that pick and
Take it with you.
I have
My
some
husband
because-
has them everywhere. They're in every coat
Oh, my
pocket.
boyfriend too.
They're-
Yeah. I saw him in his right beside his bed in his work truck. I'm like, I don't care when you floss, just please floss.
But my molars on this side, on the back, are really tight together.
That was going to be my
and I
next
I
question.
tend to shred the
floss.
floss. On
Or
this
get
side.
There's a few
hot.
things you can do. Well, are you a grinder? Do you notice
Yes, I
grinding?
am.
Okay. So people who tend to grind mostly at night, again, stress, you don't realize you're doing it, right?
That's true.
So a night guard is your first thing. And the dentist can actually open the spaces up a little bit for you. But when you grind, you're taking your tooth and you're flattening it. You're almost giving it like a little head, like a
Ledge.
nail to it. That's right.
Okay.
So it's tight to get in there. So, yeah, and there is satin floss. There's a floss that, you can get in there, but really tell your dental professional, and they should be able to help. Yeah.
should we brush our tongue?
Yes.
Brush our tongue.
Biggest leading nasal drip and bacteria in your tongue are going to be the biggest causers of actually bad breath or odor, especially if you're a coffee drinker or a smoker. So brushing it, but you have to be careful. You can actually damage the papilla on your tongue, so you want to brush down, or you can buy tongue scrapers at shoppers.
seen
And
those.
I've seen
places
those. They
around.
look brutal.
no, they're just
No?
they just kind of go. They're like little hairs on your tongue, right?
Uh-huh.
So they're just kind of brushing those hairs, and it's not damaging. But what can be damaging? A person that's sitting there, really scrubbing,
Just going to town.
going to town. And listen, I've done it. I still.
Sure, interesting.
Well, we've got 1 minute left. Tell us, wrap it all up.
Okay.
Things that you don't want our viewers to miss.
I don't
that?
want you to miss on the childcare is my biggest thing.
Okay.
I'm going to say childcare is my biggest thing. Brushing twice a day, making sure that your child, even if they have one tooth, rub that tooth with a face cloth. Get them in at a year old. See our office. Experience all that stuff.
So it's not so scary.
Right?
Traumatic
Fear
when
is
I was
learned.
little.
Fear is learned.
Yes.
You're not born afraid of the dentist. So as mothers and
think I was.
fathers, be careful. And come visit me.
And come visit
Mary
you.
Michie
And
Smiles Family Dentistry.
Exactly. Well, again, thank you so much, Jillian,
Very
for
good
joining
information.
us. We want to say thank you to Kristen, who was
have to
here
go floss
earlier.
now.
I know.
Kristen.
I think I do this to everyone.
Thank you for joining us. We'll be back again next week with Have a Chat.
Merry Christmas, everybody.
Merry Christmas.